Hello, everyone, and welcome to another episode of Renal Voice. I'm Danish Ahmed.
And I'm Caleb Lee. Today, we'll be diving into treatment options and management strategies for chronic kidney disease, known as CKD.
That's right, Caleb. Living with CKD can be challenging, but there are many ways to manage the condition and maintain a good quality of life.
So now, we're going to cover a range of topics today, from medical treatments and lifestyle changes to medical well-being and patient advocacy. So let's get started. Segment 1. As you can see on the slides, we're going to first start with medical treatment and medications. First up, let's talk about medical treatment and medications. There are several medications used to manage CKD, including blood pressure medication, diabetes medication, and medications to lower cholesterol. These medications,
It's fine, Caleb. These medications play a crucial role in protecting kidney function. For instance, blood medications like ACE inhibitors and ARBs also help reduce the strain on your kidneys by lowering blood pressure and preventing further damage. These medications are particularly effective in reducing proteinuria, which is the presence of excess proteins in the urine, a common issue in CKD patients. Additionally, other antihypertensive drugs such as beta blockers, example of metoprolol, and calcium channel blockers, one example is allodefine, may be prescribed to maintain optimal blood pressure levels.
That's right, Danish. And furthermore, for patients with diabetes, managing blood sugar levels is essential. Medication like insulin, metformin, and newer classes like SGLT2 inhibitors like empagliflozin, I'm pretty sure you and GLP-1 receptor agonists like liraglutide help control blood sugar levels. SGLT inhibitors in particular, now they have been shown to protect kidney function and reduce cardiovascular risk in CKD patients. These medications work by preventing the kidneys from reabsorbing glucose, which lowers blood sugar levels and excretes excess glucose through urine. So they also help reduce the workload on the kidneys and anti-inflammatory, and therefore they have anti-inflammatory properties.
That's right, Caleb. Lowering cholesterol is crucial too, as high cholesterol can lead to cardiovascular problems. Statins like atorvastatin and rovastatin are commonly prescribed to manage cholesterol levels and protect heart health. Statins help reduce the risk of a heart attack and strokes, which are common complications in CKD patients. They work by blocking a substance your body needs to make cholesterol, thereby reducing the LDL, known as a bad cholesterol, and potentially raising the HDL, the good cholesterol in the human body.
Furthermore, dialysis is another critical treatment option for CKD patients. There are two main types, hemodialysis and peritoneal dialysis. Hemodialysis involves filtering your blood through a machine, typically at a dialysis center. Patients usually need sessions 3 times a week, each lasting about 4 hours, and it helps remove waste and excess fluid from the blood. This process involves inserting needles into the vascular access, often in the arm, to circulate the blood through the dialyzer. While this process can be exhausting, it is vital for patients whose kidneys are no longer able to perform these functions.
That's right. Peritoneal dialysis alternatively uses the lining of your abdominal cavity, known as the peritoneum, to filter blood and can be done at home. There are two main types of peritoneal dialysis: continuous ambulatory peritoneal dialysis, known as CAPD, which is done manually throughout the day, and automated peritoneal dialysis, known as APD, which is done overnight using a machine. CAPD requires a patient to perform exchanges where the dialysis solution is drained and replaced 4 to 5 times a day. APD typically involves connecting to a machine at night, which performs the exchanges automatically while the patient sleeps.
Alternatively, kidney transplantation offers a more permanent solution for some. This process includes getting on a transplant waiting list, finding a match, and undergoing surgery. Post-transplant care involves immunosuppressive medications and regular follow-up to ensure the new kidney functions well and prevent rejection. Immunosuppressive drugs such as tacrolimus, mycophenolate, and prednisone are crucial for preventing the immune system from attacking the new kidney. These medications require careful monitoring to balance the prevention of rejection with minimizing side effects.
That's right.
Lifestyle and dietary changes. Now, let's move on to lifestyle and dietary changes. Diet is incredibly important for CKD patients. Working with a dietitian can help create a meal plan tailored to individual needs.
Okay, so key dietary recommendations include reducing sodium intake, limiting phosphorus-rich foods, and eating a balanced diet with adequate protein. Sodium can increase blood pressure and cause fluid retention, so it's crucial to limit processed and salty foods. Avoiding adding salt to meals and opting for herbs and spices for flavor can make a very big difference. Reading food labels and choosing low sodium options are also essential steps.
High phosphorus levels can cause bone and heart problems in CKD patients. Food high in phosphorus include dairy products, nuts, seeds, and cola drinks. A dietitian can help find low phosphorus alternatives and recommend phosphate binders if necessary. Phosphate binders are medications taken with meals that help prevent the absorption of phosphorus from foods, thereby controlling phosphorus levels in blood.
That's right, Caleb. Adequate protein intake is essential, but high quality sources like lean meat, fish, eggs, and plant-based proteins are important. Protein needs may vary based on the CKD stage and dialysis status. We've talked about the CKD stages in our first podcast. If you guys want to look that back up again. For example, proteins on dialysis may require higher protein intake to compensate for protein loss during the dialysis process, while those not on dialysis may need to limit protein intake to reduce kidney workload.
Staying hydrated is very important, but fluid intake must be monitored. Consult a healthcare provider to determine the appropriate amount. Overhydration can lead to swelling and high blood pressure, while on the other hand, dehydration can worsen kidney function. Patients should also be mindful of their total fluid intake, which includes not only water but other beverages and foods with high water content such as soup and fruits.
Regular physical activity helps manage overall health and can slow CKD progression. Activities such as walking, swimming, or yoga can make a big difference. Exercise helps maintain a healthy weight, lowers blood pressure, and improves cardiovascular health. It's important to choose activities that are enjoyable and sustainable, and to start gradually increasing the intensity and duration as fitness improves.
What is most important, as we covered before in our previous podcast, is to avoid smoking and limit alcohol. Smoking can accelerate kidney damage, and excessive alcohol strains the kidneys and further raises blood pressure. Quitting smoking and moderating alcohol consumption can significantly improve overall health and kidney function. There are many resources available to help with smoking cessation, including counseling, support groups, and medications. Segment 3.
Now
Monitoring.
Now we'll go to monitoring and regular checkups. So regular monitoring is crucial for managing CKD. Routine blood and urine tests track kidney function and detect changes early, allowing adjustments to treatment plans. Key markers include glomerular filtration rate, known as GFR, serum creatine, and urine albumin levels. Regular testing helps healthcare providers assess the effectiveness of treatments and make the necessary adjustments.
Furthermore, monitoring blood pressure at home is important too. Keeping it in check can prevent further kidney damage. Using a home blood pressure monitor and keeping a log of readings can be very helpful. Take readings at the same time daily and follow proper technique for accuracy. Consistently high readings should be reported to a healthcare provider for potential medication adjustments.
For diabetes patients especially, managing blood sugar levels is vital. Regular checkups with healthcare providers to monitor levels and adjust medications are essential too. Continuous glucose monitoring, known as CGM devices, provide real-time data for informed diabetes management. CGM devices can alert patients to high or low blood sugar levels, helping them make timely adjustments to their diet, activity, or medications.
Now on to segment 4, mental and emotional well-being. Now, speaking of laughing, it is important to be happy, as we'll cover, because being happy and having hope, as shown in the slides, is genuinely a helpful tip for one to cope and to live their life to the fullest extent despite their diseases. Now, living with CKD can be emotionally challenging. Addressing the psychological impact is important, as many patients experience anxiety, depression, and stress. Chronic illness can lead to feelings of helplessness, frustration, isolation, making mental health support a very critical component of CKD management.
That's right. Coping strategies and support resources are available for patients and families. Mindfulness, meditation, and relaxation exercises help manage this stress. Practices like deep breathing, progressive muscle relaxation, and guided imagery can promote relaxation and reduce anxiety. Staying connected with loved ones and seeking emotional support is beneficial. Building a strong support network of family, friends, and fellow patients can provide a sense of community and also encouragement.
Speaking of which, joining support groups provides community and understanding. Connecting with others who share similar experiences offer comfort and practical advice. Online forums with local groups can be valuable for sharing experiences and finding encouragement. Support groups can also provide a platform for discussing challenges, celebrating successes, and learning new coping strategies. Therapists can offer various therapeutic approaches, such as cognitive behavioral therapy, CBT, which helps patients identify and change negative thought patterns, and acceptance and commitment therapy, ACT, which encourages acceptance of the condition and commitment to positive change. Therapy can also provide a safe space to express emotions and explore coping mechanisms.
Let's also talk about the role of mindfulness in managing CKD. Mindfulness practices involve staying present in the moment and accepting one's thoughts and feelings without judgment. Techniques like mindful breathing, body scans, and mindful walking can help reduce the amount of stress and improve the overall well-being for a person. Research has shown that regular mindfulness practice can lower stress hormones, enhance mood, and improve sleep.
Well, another important aspect is maintaining a sense of normalcy and finding joy in everyday activities, as mentioned before. What can help with these will be hobbies, interests, and social engagements, as they can provide a distraction from the illness and improve your overall quality of life. Activities such as reading, gardening, painting, or playing an musical instrument can be therapeutic and fulfilling.
Family members and caregivers play a crucial role in the emotional well-being of CKD patients. They can provide practical support, emotional encouragement, and companionship. It's important for caregivers to also take care of their own mental health and seek support when needed. Caregiving can be demanding, and caregivers should not hesitate to ask for help or take breaks to recharge.
Education and empowerment are also key. Understanding the disease, treatment options, and self-care strategies can reduce anxiety and increase confidence in managing CKD. Patients should be encouraged to learn about their condition, ask questions, and actively participate in their healthcare decisions.
Finally, let's not forget the value of hope and positivity. Maintaining a hopeful outlook and focusing on aspects of life that bring joy and fulfillment can make a significant difference. Positive affirmations, gratitude practices, and setting achievable goals that can help patients and stay motivated and also optimistic.
Finally, let's get into patient advocacy and empowerment. Now, being an informed and proactive patient is crucial. So, one should ask questions, seek second opinions, and take an active role in healthcare discussions. Understanding your condition and treatment options helps make informed choices.
That's right. Numerous resources, such as the National Kidney Foundation and the American Association of Kidney Patients, offer support and education. They provide information on CKD management, treatment options, and patient rights. Educational materials, webinars, and support services can help patients and families navigate CKD complexities.
Therefore, empowering yourself with knowledge and staying engaged in a healthcare journey can significantly impact CKD management. Advocating for a health leads to better outcomes and a higher quality of life.
Self-advocacy involves being well-informed about your health status, understanding your treatment plan, and communicating effectively with healthcare providers. Patients should feel empowered to voice their concerns, ask for clarification, and request adjustments to their care plan when necessary.
Accessing reliable information is key to self-advocacy. Patients can benefit from reading reputable sources, attending educational seminars, and participating in support groups. Keeping a health journal to track symptoms, medications, and appointments can also be helpful.
Legal and financial advocacy is another important aspect. Understanding insurance coverage, patient rights, and available financial assistance programs can alleviate some of the stress associated with managing a chronic illness. Organizations like the National Kidney Foundation offer resources to help patients navigate these challenges.
Patients should also consider participating in clinical trials. Clinical trials offer access to new treatments and contribute to medical research. Patients interested in clinical trials should discuss their options with their healthcare providers and consider the potential benefits and risks.
Lastly, engaging in community and advocacy work can be empowering. Volunteering, participating in awareness groups, and also awareness campaigns, and joining advocacy organizations can provide a sense of purpose and also connection. These activities can also help raise the awareness about CKD and support efforts to improve care and treatment for all patients who have.
Finally, the call to action to end off our podcast for today.
So before we wrap up, we encourage all of our listeners to schedule regular checkups and screenings, especially if they have CKD risk factors. Early detection and protective management prevent complications.
And furthermore, it is important to spread awareness about CKD by sharing information with friends and family. Early detection makes a big difference, and educating others promotes healthier lifestyles and CKD prevention.
Get involved in CKD advocacy and support initiatives. Volunteering, participating in fundraisers, or joining awareness campaigns can make a positive impact. Your involvement can improve the lives of CKD patients.
And that's all for today. In today's episode of Renal Reach, thank you for joining us. I'm Caleb Lee, and this is
Renal Voice. And I'm Danish Ahmed. See you next time.
Hello, everybody. Welcome back again. Here is a recap of what we talked about on podcast number 3, treatment options and management strategies for chronic kidney disease. I'm Caleb Lee.
And I'm Danish Ahmed.
Let's begin.
So for our agenda today is that we will first have an introduction to CKD, of course, And then we will have medical treatments and medications, lifestyle and dietary changes, monitoring and regular checkups, mental and emotional well-being, patient advocacy and empowerment, our call to action, and then finally our conclusion.
Now let's begin. Introduction to chronic kidney disease. Chronic kidney disease is characterized by a gradual loss of kidney function over time. It is classified into 5 stages. As with the early stages often being asymptomatic, and thus this is why in the previous podcast we often refer to it as a silent killer. Now furthermore, recognizing the risk factors such as diabetes, hypertension, and family history is therefore crucial for early intervention. As for the importance of management, effective management of CKD is vital as it helps slow the progression of end-stage kidney failure, reduces the risk of cardiovascular events, and improves quality of life. Proactive management strategies can encompass medication adherence, lifestyle modifications, and regular follow-up care. The goals of the episode is to provide an inclusive overview of treatment options, highlight the importance of lifestyle changes, and empower patients with knowledge to advocate for their own health, which ultimately improves outcomes.
Okay, so now we will talk about medical treatments and medications. So comprehensive approaches to managing CKD through pharmacotherapy. So the types of medications we'll talk about has been previously stated too. Medications commonly prescribed for CKD include angiotensin converting enzyme ACE inhibitors, angiotensin receptor blockers known as RBSs, diuretics, phosphate binders, and erythropoiesis stimulating agents, each targeting specific complications of CKD. Then we'll talk about the role of blood pressure medications. Basically, just meaning that maintaining blood pressure within normal limits is crucial for CKD patients, as hypertension exacerbates kidney damage. Medications such as ACE inhibitors not only control blood pressure but also provide kidney protection by reducing proteinuria. Of course, maintaining blood pressure also means maintaining also your heart health, so that's also beneficial too. Diabetes management for diabetic patients, tight blood glucose control is paramount to prevent further kidney damage. This can involve the utilization of insulin, metformin, and other medications tailored to the individual needs. For cholesterol control, as previously mentioned, statins and other lipid lowering agents play a role in reducing cardiovascular risks in CKD patients, as heart disease is a leading cause of morbidity in this population. Regular monitoring of lipid profiles informs treatment efficacy. And now we have dialysis options. As CKD progresses to advanced stages, dialysis may become necessary. There are 2 main types, hemodialysis and peritoneal dialysis, in which we went much in depth in our first part of this podcast, which require comprehensive patient education to optimize outcomes and ensure satisfaction. And then finally, we have kidney transplantation. Kidney transplantation is a viable option for eligible patients, offering a potential cure for end-stage renal disease. Evaluation of transplantation includes assessing medical, psychological, and psychological factors to ensure successful outcomes.
And furthermore, there are also lifestyle and dietary changes that one has to consider. Importance of diet. A well-balanced diet is foundational in managing CKD. Nutritional counseling to identify appropriate foods can play a significant role in slowing disease progression and managing comorbid conditions such as hypertension and diabetes. Sodium and phosphorus intake monitors and limits which means monitoring and limiting sodium and phosphorus intake. And this is essential for CKD patients to prevent fluid retention and manage mineral balance, respectively. This would require educating patients on reading food labels and making informed choices. Furthermore, dietary protein should be sourced from high-quality protein options while being mindful of quantity, especially in advanced CKD stages. To minimize the burden of the kidneys, plant-based proteins are often recommended due to their lesser impact on kidney function. Hydration management. Maintaining optimal fluid intake is crucial, although the volume may need to be restricted as kidney function declines. Understanding individual needs is essential to prevent dehydration and fluid overload. And as for physical activity, regular physical activity benefits overall health and can help manage weight and blood pressure. Tailored exercise programs can enhance patient well-being and are often underutilized in CKD management strategies. And last but not least, abstaining from alcohol can minimizing tobacco and alcohol consumption as a whole is very vital for kidney health. Educating patients on the adverse effects of these substances can empower healthier lifestyle choices.
Yes, all great points made. Now we will talk about patient advocacy and empowerment. So the importance of informed patients. Educating patients about CKD empowers them to make informed healthcare decisions, fostering a sense of autonomy and engagement in their treatment plans, which is pivotal for achieving positive health outcomes, and also just general confidence too. Resources for education. Providing access to reliable resources, including educational materials, workshops, and online courses that can promote patient knowledge and engagement, ensuring they understand their condition and management strategies. For self-advocacy, encouraging self-advocacy skills allows patients to articulate their own values and preferences in medical settings, enhancing shared decision-making and personalized care plans, be it for their disease too. And legal and financial advocacy. Understanding patients' legal rights and available financial resources can alleviate many concerns patients face when navigating the healthcare system, ensuring better treatment access. And as you can see, this also correlates and connects for self-advocacy too. And then finally, community engagement. Involvement in local advocacy organizations helps to build a supportive community, fostering shared experiences and strategies for management while amplifying their voices for systemic change.
And finally, the call to action. Encouragement for regular checkups will be like reminding patients and caregivers of the importance of routine monitoring and follow-up appointments to maintain kidney health and overall well-being. Advocating for broader awareness campaigns that emphasize the risks, signs, and management of CKD to foster early detections and intervention within the communities is also very vital. And finally, one should also get involved. Encourage community members to participate in local and national advocacy efforts to improve policies, fundings, and resources available for CKD patients and research.
Monitoring and regular checkups. So the importance of regular monitoring. Regular follow-ups enable healthcare providers to track the progression of CKD, adjust therapies, and identify complications early, leading to improved management and patient outcomes. Key tests for kidney function. Blood tests such as serum creatine, estimated glomerular filtration rate, known as eGFR, and urinalysis are essential for evaluating kidney function. Educating patients on the significance of these tests is key to fostering adherence to monitoring schedules. Home blood pressure monitoring. Utilizing home blood pressure monitors can empower patients to take charge of their health by tracking their blood pressure on their own and understanding the importance of maintaining optimal levels. And finally, diabetes management. For CKD patients with diabetes, regular monitoring of hemoglobin A1C levels is critical to ensure effective glycemic control to mitigate renal impairment. Collaboration with endocrinologists can enhance the treatment efficacy.
And finally, the conclusion. To recap, this lecture highlighted the importance of understanding CKD, the array of treatment options available, lifestyle adjustments, and the necessity of regular monitoring and emotional support. Emphasizing a multidisciplinary approach to CKD management enhances quality of life and healthcare outcomes for patients, combining medical, lifestyle, and emotional strategies for a comprehensive care plan. And furthermore, we want to encourage further listening and explore CKD management methods in later episodes to emphasize the value of patient engagement and empowerment in healthcare settings. Thank you, everyone.